Overactive bladder is something that happens to the bladder where the bladder becomes, just as the name says, overactive. People develop this urgency, frequency, and overactive bladder, interestingly enough, can become dry or wet. So we think of overactive bladder as people always have incontinence, and that's not true. 2/3 of overactive bladder can be dry overactive bladder. So urgency, frequency, not necessarily having incontinence, having accidents, but still having that urgency, frequency. Normal urination is urinating 6 to 8 times in a 24-hour period. So anything above that is considered overactive. Whether or not you have accidents, anything above 6 to 8 times in a 24-hour period is considered overactive. Overactive bladder symptoms include urgency, frequency, and getting up many times at night to urinate. Again, normal urination is urinating 6 to 8 times in a 24-hour period. That can include getting up once or twice at night. Anything over that can be a symptom of overactive bladder, and that can include having accidents. That urgency, frequency, gotta go, gotta go, gotta go, getting to the bathroom, and before you get there, having a little leak, that is a symptom of overactive bladder. Overactive bladder is a very prevalent condition. 50% of women will experience this in their lifetime, and interestingly enough, 1/3 of men will experience this as well. Now, we always think of this as a female condition, and we always think of this as older women, but actually this can occur at any time in a woman's life or a man's life. I've got some young ladies that are 18, 19, 20 that have overactive bladder. It is more common after menopause, but it can occur at any time in your life. Again, it's more common in women than men, but I've got 1/3 of male patients that experience overactive bladder symptoms as well. So it is a very common problem, and again, can occur at any time in a patient's life. Overactive bladder is certainly a nuisance. It's not life-threatening, but it is certainly a nuisance. If you can't sit through your son's baseball game, if you can't sit through a movie, if you're afraid to go on camping adventures because you have to get up 4 times at night in the middle of the night to urinate, that absolutely affects your quality of sleep, your quality of life during the day. It affects your work. If you have to get up and urinate every 30 minutes during your job, that affects your work life. If you've got to find the toilet every place that you go during your day, that definitely affects your life. So this is certainly a nuisance. Even if you don't have incontinence, even if you're not wearing pads, having to find a toilet, we call these patients toilet mappers because they map their day based on clean toilets. It definitely affects your life. Overactive bladder can be treated conservatively. So you can first start by changing your diet. There are lots of dietary things that can affect overactive bladder. Cranberry juice, citric juices, tea, carbonated beverages, caffeine, alcohol, spicy food, chocolate. There's lots of things that we consume every day that can irritate the bladder. And simply cutting out some of those bladder irritants can affect the bladder and help to relax the bladder so that your bladder can hold more. It's not just a matter of drinking less fluid, but changing some of the beverages and changing some of the food products that you put in your mouth. So changing your diet can certainly help with overactive bladder symptoms. Once you've changed that and you're still having overactive bladder symptoms, then we move on to what we call medications. Medications are prescriptions. There is one over-the-counter product. It's a patch that you place on your abdominal region. It's called Oxytrol, but that's the only over-the-counter product. After that, it is a prescription product that you take. These are pills that relax the bladder and allow the bladder to hold more. These are antimuscarinic medications or beta agonists, and these medications bind to the receptors in the bladder and again help the bladder to relax so the bladder can hold more, so that you don't rush to the bathroom. It may not give you a perfect result, but it certainly helps so that you can get a more normal result during your day. Other options for overactive bladder are Botox injections, InterStim, and acupuncture for the bladder. So Botox injections are something that we do just in clinic. We take a small scope and inject several little spots in the bladder. This lasts for about 9 months. Acupuncture for the bladder, there's a nerve that goes to the bladder in the tailbone area and travels down to the ankle, and we can have you come into the clinic once a week for 12 weeks, stimulate with a small needle in the ankle area to help relax the bladder. And a third option is called InterStim. We stimulate that same nerve in the tailbone area in the S3 with a small wire and actually implant a small little pacemaker battery in the bottom area. The battery lasts for 5 years, so it's a little bit more of a permanent fix for overactive bladder. So there are other options besides medications if the medications fail.